I am Dr. Saurabh Patwadhan from Nandadip Eye Hospital, Sangli, Maharashtra, India, and in this video I will be showing an innovative diathermy assisted pupilloplasty which is particularly useful for centration of an eccentric pupil. Now in this particular case which I am demonstrating, a 60-year-old female, anesthetist by profession, there was a history of childhood trauma and subnormal vision since then. Further decrease of vision was noted with age due to cataract. The patient's visual axis was obscured by the iris, so we did dilated biometry and we found that patient also required a toric IL implantation. Now in this particular case, the particular concern was how to center this extremely eccentric pupil. So how to do the pupilloplasty? There are two options, which is cutting the pupil with scissors or use of vitrectomy probe, but both these options will give rise to fixed dilated pupil. Otherwise, we should try something which will preserve the sphincters. So the first part included use of iris hooks to complete the cataract extraction and then implantation of the IOL. The IOL was placed in the axis which was required, aligned along the marks there, and then removed OVD from the bag and then only placed cohesive OVD in the anterior chamber. Now I tried to release the iris which is incarcerated in the old injury there, and the main problem was the visual axis was still obscured by the iris. So in order to open this visual axis, I used unipolar diathermy, energy in a linear fashion, and the heat produced here causes shrinkage of the collagen in the iris, leading to retraction of those radial fibers. And as I use this diathermy along the area, you can see that the pupil starts moving towards the area which is diathermized. Thus the visual axis is now open, and the other part of the iris was now sutured using the single pass 4-throw pupilloplasty. Further modifications can be done by use of diathermy. You can see that I have marked the visual axis using the dye there and made sure that the iris is completely open in the area of visual axis. This is single pass 4-throw pupilloplasty using 9-0 proline. Thus the pupil is again made smaller. OVD was completely removed at the end, and this is the end of the case here. I found post-operatively it was very good result. Vision was 20/20 unaided, and after 1 year as well I found that the uncorrected visual acuity remained. There was no iris chafing there or iris atrophy, and cosmetically as well as visually the results were good. So this is the innovative concept of using unipolar diathermy to shrink the iris tissue so that the pupil can be again recentered. Thank you very much.